The meeting will begin in about 4 minutes. The meeting will begin in about 3 minutes. The meeting will begin in about 2 minutes. The meeting will begin in about 1 minute. All right, Tracy. I have 2 o'clock.
Okay, good afternoon. This is Tracy Aaron with the Health Department, and we are here for our bi-weekly update on COVID-19. And we have some members of the executive team who's going to answer questions that were submitted over the past few weeks. I do want to remind people that if you have questions as we walk through the meeting today, just type those in the chat box and we will do our best to answer those as we walk through. Mr. Crabtree, why don't you give us an overview or an update of COVID over the last couple of weeks across Lake Cumberland?
Okay, I'll just give totals. These numbers are available daily by way of our daily brief that we post on our website and social media. We've had a total of 21,060 cases as of last night in our district, 1,761 in Adair, 1,309 in Casey, 1,420 in Clinton, 664 in Cumberland, 1,166 in Greene, 1,859 in Macquarie, 6,035 in Pulaski, 1,794 in Russell, 2,907 in Taylor, and 2,145 in Wayne. We've experienced a total of 377 deaths in our district so far. Of our total 21,060 cases, we've released 20,493 of those. That leaves us with 190 active cases. Of those, 25 are hospitalized and 165 on home isolation. Some other high points: the statewide testing positivity rate has continued to go down. Right now, the testing is of the folks tested, 2.93% are testing positive. Our deaths rate in our district is about 1.79. Our mortality rate of known cases, it's about 1 in 56 people. At the state level, the mortality rate's 1.38%, and nationally it's 1.82% of known cases. Our hospitalizations are at 25. We've had about 5%, about 5.5% of everyone who's tested positive in our district have had to go into the hospital. That's about 1 out of every 18 people. So pretty substantial hospitalization rate. We have since January been seeing a downturn in new cases. Our new case rate has been going down. Over the last 5 days, that has changed. And for the last 5 days, the new cases per day has been higher than the equivalent day for the previous week. I hope that's not a sign that things are getting ready to go in the wrong direction. You know, we've seen through the spikes in the past, what can look like a very small thing 6 to 8 weeks later can turn into a surge. So, you know, it's really important that everyone take the vaccine as soon as you can, and continue to observe the precautions. I know sometimes people ask how many folks are becoming reinfected with this. I think this morning we looked at it and it was 0.34% of our total cases are reinfections. So it's less than 1%, less than half of 1%. So it's a small number. And then sometimes people ask about what's called breakthrough cases, people who test positive after having had the vaccine. That's even a much smaller percentage. So why am I telling you that? The vaccine's effective, and so far the folks who end up testing positive after they've been vaccinated is extremely, extremely small, much smaller than 1%. And the vaccine is supposed to be 95% effective. So in our area, it's doing, you know, the reinfect or the breakthrough cases is less than what's even expected, at least at this point in time. So it at the world level and at the let me share a slide here if I can figure out how to do that. Stuart, are you seeing the slide? Okay, so this is something that was shared at a meeting I just got out of. It shows at the world level, you know, the United States saw a sharp decline beginning in January that kind of had plateaued. And then we had a pretty good sharp decline beginning in March, and now it's plateaued again. So you can see for the last few days, it's kind of evened out. We're not going down, we're not going up. You can see the European Union are having a pretty sharp increase. You can see India is having an increase. Brazil is having an increase. So, you know, we're not out of the woods completely. And on this chart, this is states. And there are states in the nation that are seeing increases. New Jersey is starting to see another surge. Pennsylvania, Michigan, and there may be some others that's kind of blotted out. But my point in showing that is we're not out of the woods yet. So do take the vaccine as soon as you can get it. We had a whole lot of people taking the vaccine early on. The vaccine is widely available in our communities now, and a lot of places are reporting that they're not filling all of their slots. So, you know, just about anyone now qualifies to take the vaccine. So please get it. I've got another slide I will show you. This is a publicly available slide that's on the CDC website. It's a site that we look at to see trends at the state level. This one is how vaccinations are going in the United States. So I've got this set to as a percent of the state's population, not looking at raw numbers. You want it to be as a proportion of the state's population. 100,000 doses in Kentucky is much smaller percent of the population than 100,000 doses in California, for example. So you want to use percent of population. And I clicked this option, at least one dose. So that gives you unique individuals who've had the vaccine. And the darker color, the better. So you can see Kentucky is one of the better states. There are a couple states that are doing better. South Dakota has given 30.5% of its population. New Mexico, 33.4, Alaska, 31.6. But here in Kentucky, we're at 27.6% of our population. You can see Tennessee's not doing as well. Indiana's not doing as well, or Illinois, Indiana, Ohio. West Virginia's at 26.6%, so we're ahead of them. And then Virginia is at 26%. So Kentucky is doing good. It is concerning. Let me stop sharing. It is a little concerning that we're seeing states that are having an uptick in cases. We've seen locally over the last 5 days, our cases have started to slowly tick back up. We know we have lots of vaccine out there, and we need the folks that are under 60 to get it now. We had a real push at the beginning to get 60 and older, 70 and older, 60 and older, because that was the most vulnerable population in terms of death and hospitalizations. But we need everyone to get the vaccine so we can reach the herd immunity and stop the spread before it spikes on us again. So do use the precautions, do get the vaccine. Dr. Wayman, Stuart, you want to add anything to any of that?
Just the only thing I'd say, Sean, is I've in the past couple of weeks, I've been reaching out to lots of people, and we'll talk about scheduling clinics and things here later on, I think. But I've talked to a lot of people who they tell me they want to get back to normal, but in the same breath, they tell me that they're not going to take the vaccine. So that's like having your cake and eating it too, and that just doesn't work.
What do you say, Dr. Wayman?
I agree totally. I mean, if you want to be protected, the vaccine seems to be even better than natural disease in protecting you against infection.
Yeah. There was an outbreak in a nursing home in eastern Kentucky, and I don't remember the percentages just off the top of my head, but there was some the staff had been less likely to be vaccinated than the residents, and the staff caught it at a much higher rate than the residents. The residents that caught it, the ones who hadn't been vaccinated, caught it at a much higher rate than the ones who had. And of the few that had been vaccinated that got it, their health outcomes turned out a whole lot better. No deaths, I think, and maybe one person got sick enough to go to the hospital. But it shows that the vaccine was effective in preventing it, and if you happen to get it after having been vaccinated, it was very effective in decreasing death and hospitalization. So while that's not a large enough sample size to be statistically significant, it was, at least subjectively, it looked like the vaccine was doing exactly what we want it to do. So we certainly want people to take the vaccine.
Right. Are you all ready for questions?
Sure.
All right. First question. Early in the response, why weren't you able to provide the public with a list of locations to get tested?
Okay.
Who wants that? Sean, okay.
I'll go ahead and give the first reply, and then I'll let Stuart and Dr. Wayman jump in. In the beginning, when testing was just getting started, testing supplies were largely unavailable. And testing sites, because of the extremely limited supply of testing kits, testing sites were constantly going up and down. And then some of the places that wanted to do testing would do it a few days as maybe a promotion for their business to get customers into the business. But then, they would decide that they didn't want to fool with it anymore, so they would stop testing. We weren't being kept informed by the state, and the locations that were doing testing was not obligated to tell us when they were going to test and when they would start and when they would stop. And it was really, at the early point, it was really hard to keep up with who was doing testing and who wasn't. The only way we could have kept up with that would have been, I don't know how. I mean, we would have had to call all the medical places in our entire district every day to try to get information. And we were so overwhelmed with contact tracing and case investigations, we didn't have the staff to dedicate to doing that. It was just a very few days, though, until the governor or the state posted a site. I mean, it was probably within just a week or two, where all the testing locations could register, and that became a very useful site. And we immediately started publicizing that site where you could go and look and see where the tests were being administered at. So we did everything we could in that regard. So I don't know, Stuart or Dr. Wayne, if you want to add anything I've left out.
I would just say that in answering, this is going to apply to a lot of these questions. So the health department, even though we have some autonomy, we are actually the Department for Public Health in the community. So we do follow the guidance and the rules set forth by the Department for Public Health. We are in essence the Department for Public Health. So early on, just like you'll see a lot of these questions as we go through, the Department for Public Health wasn't actually looking for necessarily health departments to become testing sites either. That was left up to the providers that decided to do that, and the state hooked them up mainly with Gravity Lab. It did take a little bit of time also for that to come online. The state lab was doing most of the testing, and the state lab's capacity wasn't quite up to where it needed to be until they got Gravity on. So there was some issues getting that going. But again, like going back to what Sean said initially, and really throughout this thing, one of our biggest jobs has been case and contact investigation that has taken up a tremendous amount of staff and a tremendous amount of staff time. Not only did we do those investigations, but the people who decided that they didn't want to quarantine or didn't want to isolate, we had to end up chasing those people down. So there was a lot of work to do in that without having us to be a testing site on top of that. However, and I think in the next question, Sean will talk about, we did actually do some mass testing as a little bit of time went on. So we did do some of that.
And leading right into, Dr. Raymond, do you want to share something?
It looked like she was going to say something a minute ago.
I was just going to say that at the very beginning, we only had big labs that were doing it. And it mostly people who had symptoms were being tested by their primary care providers. And it was several months before we had rapid tests, so to make it a lot easier to test on a more regular basis.
Okay, thank you all. The next question is, why didn't you become a testing site?
As Stuart alluded to, we simply didn't have the human resources to become a testing site. You have to make a decision in this kind of thing. Who's got the capacity to do what? And we knew that there were medical providers in the community who, it's not their job to do case investigation and contact tracing. That's clearly a health department job. And while we could have done testing, we just didn't have enough staff to do it. So our focus was coordinating with community partners to become testing sites. One thing we did do, though, is we became a testing distribution center. While we didn't do the testing, in a lot of instances, we did facilitate the testing by becoming a testing kit distribution site. We ordered and provide testing kits to several thousand testing kits to several community partners, and we ended up trying to order rapid test machines and testing strips, and those ended up being on back order because of the demand for testing at the world level. So that was several months coming through, even though that we ordered them very early on. We did support several mass testing sites, as Stuart alluded to. We worked with community partners and we supplied testing kits, and we couried the testing kits from the site and submitted them to the labs. And we helped provide staff for that and advertising and so forth. So, we did a lot of stuff. We've provided support for several months through the state contract with Gravity Labs. So there was a lot that we did in testing, even though we weren't a testing site. We overseen a lot of it. So again, Stuart or Dr. Wayman, you may know a little more details than I do.
That's about right. That's exactly what happened.
Okay, next question. Thank you, Sean. Why were school staff put at the back of the list when it came to testing and vaccination?
Yeah, again, early on, there wasn't enough testing kits to prioritize any group, schools or otherwise. And, it wasn't very long, though. I mean, it seems like a long time, but you got to remember, we've just had our first case just a little over a year ago. So a lot has happened in a year, which is a short period of time. Normally during a pandemic, it feels a lot longer. I understand, but testing became more readily available very, very quickly, and it became possible very quickly for anyone that wanted a test to get one through our community partners. So it was just one of those issues where no group was able to be prioritized for testing, and then early on, and then the testing became so widely available that anyone that wanted it could just go get it at one of the community partner sites. As far as vaccination efforts go, the state has pretty much, we have consistently followed the lead of the State Department for Public Health, and the State Department for Public Health has consistently followed CDC's recommendations. And it was the CDC that came out with the different tiers of who was going to be vaccinated when. Kentucky did, even though it feels like teachers were put on the back burner, they really weren't. I mean, Kentucky was one of the very first states in the nation to vaccinate the teachers. I know I had some questions about why were some schools vaccinated, 2 weeks or 3 weeks before another school. Well, there just wasn't enough vaccine to do all of the staff at the schools all in 1 week. It just had to be parsed out over 3 or 4 weeks so that we would have enough supply. But that happened, and Kentucky was one of the very first states in the nation to vaccinate the teachers. The teachers got vaccinated right after we did. Nursing homes were first, and medical providers like hospitals and people that were working directly with patients, those were phase one. Those were the first ones. And then right after that was first responders and then school staff. So, even before the 70 and older, the school staff got ahead of them in Kentucky. So I know there's people that believe that was wrong, and there's people believe that was right. Regardless of how you fall on that issue, that's what happened. So the teachers really got in pretty early. So again, Stuart, Dr. Wayman, you may have some more details than me, but that's the long and short of it.
Yeah, I mean, I totally agree with you, Sean. And if you look at statistically, if you think the teachers were put in the back of the line, just as Sean said, the teachers went ahead of, I'm even going to bring that down to the 60 and older, where I think we have a good 95% or more of all of our deaths and all of our serious illnesses. So school staff were put in front of those people.
Yeah, and there's an argument that can be made that hospitalizations and death are not the only consequence of significance in a community. That schools not being able to be in session has other consequences that are important too. So you can make an argument that schools should have been prioritized, and I'm not going to, I don't want to debate that. I mean, you could argue either side very effectively, but the school staff were, they were put pretty high on the list.
Dr. Wayman, do you have anything you want to add?
No.
No? All right. Thank you all. Next question.
There's a comment. Let me read that while I'm looking at it. Judge Green says, I commend the entire LCDHD for a job well done in these difficult times. The folks here in McQuarrie County that we deal with on a daily basis are so helpful and keep us informed. Thank you. Thank you, Judge Green. I appreciate that.
Okay. Next question. With the push by the state Republican Party to get the schools reopened, and since square footage is limited in the schools and ventilation isn't ideal, why were social workers and mental health staff put ahead of teachers? Weren't teachers 1B and social workers and mental health workers 1C? Teachers can't just kick students out of school for being non-compliant.
Yeah, and I think the point is that there was a political push in the state to get the schools reopened as quickly as possible, and teachers are caught in a hard spot where when the students come back, kids are kids, they're not always compliant, and it's not a private business where you can just tell somebody don't come into my private business. Teachers are and school staff in general are in a more difficult position. And they are right. Square footage and ventilation and stuff is not ideal. So I think the point they're trying to make is that it makes sense that teachers would have been put high on the list because there was a push to get the schools reopened and the kids aren't always compliant. Square footage isn't ideal, and you want to get those teachers up on the list. So again, in Kentucky, that was done. I mean, the school teachers went and the school staff went very high on the list. Asking specifically about social workers and mental health staff, each week you all will see on that list on the state website about who all's in 1A, who all's in 1B, and who all's in 1C. That's a summary list. We get a detailed list when we talk about medical workers, health workers. The governor's office and the State Department for Public Health sends us a list of who all they consider medical staff, and they considered mental health workers medical staff because mental health is very important, and mental health staff have to work one-on-one with people and in group settings and so forth. And social workers, like Department of Social Services, or social workers who are counselors, or social workers who work in schools, they got pushed up into that medical staff category. So really they ended up being counted as the phase 1A group. So it wasn't that they were being pushed in front of the teachers. It was that medical staff were already ahead of teachers and they got counted as medical staff. Now you might argue that that shouldn't have happened, that mental health and social workers weren't as important as medical staff. Again, we could debate a lot of these things. I'm just telling you that was the directive we got from the State Department of Public Health, that they were going to be counted as medical workers. So that's the way we handled it. We pretty much followed their lead. And you better believe me, as all this has unfolded, every group, teachers, social workers, mental health, nursing home, factories, restaurants, I don't care what group you are, there has been politicians lined up to support specific groups, and it's been a constant battle, trying to keep this thing flowing smoothly. There's always people that want to be pushed to the front of the list of we need to go next. And from a public health perspective, from the health department's perspective, 70 and older and 60 and older, after you dealt with the nursing homes and the medical staff, 60 and older and 70 and older, we saw that that's where the death and hospitalizations are happening. So that was our priority. But it was a struggle daily for several weeks there, having different people in very powerful positions reaching out to us to try to put one group ahead or another. So it was a challenge. Let's put it like that. Dr. Wayman Stewart, do you want to add anything?
Well, just going back to what I said earlier, the even though we have some degree of autonomy here, we do answer to the Department for Public Health. We are the Department for Public Health in the community. So when the department sends us a list, when that decision is made by the department and they send us a list of how this is supposed to go, then we really have to follow that. I mean, we have to do the things that the department mandates and the guidance that they give us, that we have to follow that.
And I was going to say that mental health and social workers work in high-risk situations such as hospitals, emergency rooms, and clinics.
And that's why they got included in the 1A health workers. So again, I mean, a lot of this is a philosophical debate. You can, from a philosophical standpoint, you can debate a lot of these decisions, but regardless, that's how the decisions were made, and that's why we responded the way we did. We weren't just acting, making decisions on our own willy-nilly. These decisions were being thought out at the Centers for Disease Control and the State Department for Public Health. And of course, we were trying to do the right thing locally, but there's a lot of things that we were looking to help us make decisions. So.
All right. Thank you all. Next question. And this, I think you answered this a second ago, Sean, but why were some schools in our district vaccinated weeks after others?
Yeah. In our district, Taylor County was the first county to get their teaching staff, school staff vaccinated. They were probably the first county in the whole state to do that. And that was a little bit of I don't know if a fluke or whatever. Anyway, there was a provider in Taylor that got a substantially larger order than they needed for the phase that they were in. And in order to move that vaccine, they went ahead and did the school staff. So they got out ahead of everybody by a couple of weeks. But for the rest of the district, there just wasn't enough supply to do, every school, public and private and Christian, all at once. It had to just be spread out over 3 to 4 weeks to get it all done. We didn't decide locally which school would go first. The state, pushed out to us, Pulaski's going to go over these couple of weeks, and Wayne's going to go in this week, and McCrory will go in this week. I think they were kind of looking at, they had a certain amount to divvy out each week, and they tried to look at the size of the schools and make sure, that they were getting as much vaccine out as they possibly could without over promising. So, anyway, they rolled it out that way. So again, school staff, they went very early in the process. So Kentucky was one of the first states to get to schools vaccinated. Someone else asked me, why didn't said that a lot of the health departments vaccinated the school staff. Why didn't we personally vaccinate the school staff? Well, when that unfolded, the health departments were responsible for either providing the vaccine themselves or were responsible for coordinating that. And I had to sign an agreement saying I would coordinate that. So in our schools, every school had a contract with a medical group already to provide school nurse services. And they were interested in providing the vaccine through their existing infrastructure. So I reached out to all the superintendents, and I reached out to all the providers that were providing the school nurses for the schools to see if they wanted to go that route, and they all agreed to do that. And we all signed the agreements, and the order went up through the health department. The vaccine was delivered to the sites, and the providers that provide the school nursing provided the vaccine, and it went very smoothly. So it went well. It worked out good. It really worked out to our advantage because just a few days later, more vaccines started getting pushed to the health departments. So, we wouldn't have had enough human resources to do the community work and the school work. So we were able to let some of the community partners do the schools while we focused on the general population. And we got more vaccine out into our communities that way. So again, Dr. Wayman or Stuart, do you want to add anything to that?
And just to say that they were able, the partners that the school used and that we used, they were able to go to the school and do the vaccinations. Whereas at that time, I'm not sure that we would have been able to do that, but they were able to actually take it there. It worked out really good.
Yeah, it's just kind of like, we didn't become a testing site, but that doesn't mean that we didn't work it out so that other community partners could be a testing site, and we got the testing kits for them. So, you want to, in a pandemic, you want to use spread the response as much as you can so that no one provider ends up becoming overwhelmed.
What I was going to say, Sean. Use your partners and your resources out there. Are y'all ready for the next? I'm sorry.
It's
Go
taken
ahead.
us years to build those relationships with those community partners, and to be able to have the relationships already built where we could reach out to them and they would respond and do what we were asking to do, and or they would reach out to us and we were able to say, yes, we can accommodate your request. I mean, that's years of work building those relationships.
Definitely. Are you ready for the next question?
Yeah, well, Judge Craig listed, thank you to the entire staff at LCDHD. All you guys are wonderful. Well, thank you, Judge Craig. All right, Tracy, next question.
Next question. It seems all you guys at the health department did was count beans. How was this helpful?
Yeah, I'm assuming this question has to do with our daily brief where we give a lot of statistics. Early in the process, especially the media and the public wanted a whole lot of information. And we're probably one of the only health departments in the state that was able to continue to provide that information on a daily basis. Many of them became very much overwhelmed and quit doing those kind of daily news releases, but we were able to do that. Now, what you call bean counting is not bean counting, that's called epidemiology. And that's something that we do. It tells you where you're having spikes, and it informs you where you need to focus your response and your resources. So, without epidemiology, you wouldn't know which states were doing better or worse, or which countries were doing better or worse. You need that so you can direct your resources to the places that need it most, because everyone is short on public health resources. So, you're trying to maximize your limited resources as best you can by pushing things toward the places that need it the most. And, we do epidemiology all the time. That's a big thing that the health department does. There's a lot of things that we do in the health department that people don't know about. There was lots of things. I've made a list here of some of the stuff that we've done that the public may not even know we did. Early in the pandemic, all the public front-facing businesses, they were closed. As the health department, we had to ensure that they complied with that. That involved a lot of education in our communities. There was a lot of behind-the-scene work that the public really wasn't aware of when we were communicating with emergency responders, media, hospitals, nursing homes, schools, and businesses. We help them figure out ways to reduce the virus transmission rates, reduce contacts, improve cleaning. We also had responsibility as far as the emergency response. Early in the pandemic, there was a shortage of personal protective equipment. We were critical in helping assess where there were shortages in our community. and filling that need. We got a couple different pushes of the strategic national stockpile. We broke that down, worked with community emergency management and community partners to figure out where that was needed and to get that pushed out. As far as I know, no one ran out of personal protective equipment in our district. I know it got close a time or two, but we were in others. I mean, we don't do all of this. A lot of people work on this. We were a part of that, making sure everybody had what they needed. Sometimes that meant connecting one community partner with another community partner and sharing. Our response became very much centered around case investigation and contact tracing. That's something that only the health department does. We had to issue the isolation and the quarantine orders and enforce those in certain times. We dealt with all the non-compliance issue with the business orders that the governor put out. We've been doing the vaccine administration. I think in our district, we've given about half of the vaccine that's been given in our district through the health department. We've consistently been able to push out 90% of our responses. I remember when the first vaccine shipment came out, we got our first shipment of 1,000 doses on December 21st, right before Christmas break. And by close of business on 12/23, we had given almost all of that. So, we moved very quickly. And there's a lot of things we've done. We've pushed out even today. I personally delivered masks and hand sanitizers for the schools. We've done that several times. So, I mean, there's been a lot of things that we've done that you don't see behind the scenes that has happened. Stuart, Dr. Wayman, you want to add anything to that?
I mean, Sean, that's not even an exhaustive list. I mean, we worked on plans for operations, for schools, for businesses, for jails, just so many things. Our staff have been involved in the delivery of the PPE. Our staff now are involved in delivery of vaccine every week. And again, like you said, we have more things to deliver out. So it has been the magnitude and the scale of what we've done is actually, it's been an enormous amount.
Yeah, and we just got a mobile testing site. We're going to start trying to work with more difficult to reach populations, minority groups, and just places that are less likely to take the vaccine, and use our mobile site for that. We'll be planning for that. I know at one point we were having to help monitor hospital ventilator and isolation capacity. We called for and received a large amount of donations from the public of personal protective equipment. We stored and inventoried that, and then we connected with the people that needed it and got it delivered. So, I mean, there's just been a lot of things that we've done that people may not know that we did. Certainly bean counting or epidemiology is not the only thing we did. We've lived, breathed, and ate COVID-19 response 24/7 for the last year in so many different ways you can't even fathom. So, Dr. Wayman, what do you want to add? What have we left out?
Well, you didn't leave it out, but I wanted to underscore it. Education has been a very big part of what we've done for the last year. I mean, there's been changing situations all the way from the beginning to now. We had to educate about falsehoods, about vaccine, about the disease, about the transmission, about face masks. This has been an ongoing thing. This media presentation, obviously, we were doing very frequently at the beginning. Information that we put on Facebook and our website, it's all very time consuming.
Yeah.
And we rolled up a call center. I want to put that out there that we have staffed a call center, taking, upwards of 1,000 or more calls a week through this to answer the questions are all over the place, and just, so we've been responsible for all this information that has been put out, all the guidance, everything out there. And we've tried, like Dr. Wayman said, we've spent a huge amount of time just in education, getting that out, whether it's through these media calls or one-on-one in dealing with businesses or schools or through our call center.
The comment, LS Rondo wrote, "Every bean counts, laugh out loud." I think there are many grateful beans out there in the community that were happy to be counted. So thank you for appreciating their response.
Okay, next question. You guys did really good during the swine flu, but didn't seem to do much at all during COVID-19. How would you handle something more serious like the bubonic plague? Excuse me.
Well, I think we've just gone through a list of all the things that we've done. But, in the 20 years I've been here, there's been a variety of outbreaks we've had to deal with. We deal with outbreaks all the time. Most of the time they're small scale, like an outbreak at a restaurant, a foodborne outbreak, or a norovirus outbreak at a nursing home or something. But sometimes
Pertussis outbreaks, yeah, we still have those even.
Yeah, but sometimes they're more significant. Like we had H1N1 or avian flu, swine flu. We recently had the hepatitis A that we had to deal with. Now COVID-19. Every single response though requires a unique approach. It depends on who's most at risk. Is there a vaccine or not? There's like with COVID-19 at the beginning, there wasn't a vaccine. We use the same kind of strategies that's been used since biblical times of isolating and quarantining. Those of you that study the Bible, I mean, you'll know in the Mosaic Law, they had isolation and quarantine for leprosy, a communicable disease. In Jesus's time, the lepers would have to stand afar off. I mean, these are things that have been done, and we continue to do these things that have been proven for thousands of years as a successful way to deal with communicable disease. And that's how you have to handle it until you have a vaccine, or it just runs its course. But anyway, Dr. Wayman, you're probably the most qualified. The question about the bubonic plague, I mean, maybe you could speak to why we handled swine flu differently than we handled H1N1, and why we handled COVID-19 differently, and how would we handle bubonic plague? I'll throw that one over to you.
As far as bubonic plague is concerned, we handle it right now. I mean, we do have cases of bubonic plague in the US, and it is handled just like other communicable diseases. We find out who they are, we find out how they got it, we make sure they don't pass it on, we make sure they get treated. So that's ongoing all the time.
There's a reason why we don't have a big bubonic plague outbreak, because public health is already dealing with it.
Exactly. As far as the H1N1, we did not isolate for flu, but we did get a vaccine pretty quickly, and a lot of people were very interested and they received it. And at that time, I think it's the elderly who were not susceptible, probably because they had immunity from a similar flu some years before that in the 70s, and it was the young people that were affected. So every disease is different, every outbreak is different.
Yeah, I mean, you look at America, and while TB is still a concern, and with immigration and things, it's always a concern. But you look at TB in other countries and TB in America, and that's a communicable disease that we constantly are dealing with to keep it in control. I know, Dr. William, you've been intimately involved with TB for years. Do you want to say anything about that?
Well, we obviously isolate and treat and do contact investigations, just like with COVID. The lucky thing about TB is that if somebody has been infected but does not have disease, we have a treatment so that they don't end up with TB disease. So yes, we've been doing that for years, and the rates of TB have been coming down over the last 20 years.
Yeah.
And that goes back to the reason why you know, when we're doing what we do every day, and we're dealing with these communicable diseases that's been around for a long time. I mean, we've dealt with those. Some of those have been basically eradicated in the world. Most of the United States doesn't have a problem because of the public health system that's been in place for a long time. Now, remember, coronavirus was a novel or new disease. When you talk, just like Dr. Wayman says, bubonic plague hasn't went away, but we've controlled that. And I suspect that we will be able to control COVID as time goes on. Just like cholera used to be a huge deal. Well, we've got things in place to control cholera, thank goodness. So that you know, when we're doing what we do, that's the reason why we don't have bubonic plague outbreaks or cholera outbreaks. And there's all kinds of other stuff you can think of. There's dengue fever that comes into, or yellow fever, and there's still malaria. There's still all those things. But when we do the things we do, that's why we don't have those here.
What's the most recent one that's in the news? I keep forgetting because I'm so focused on COVID-19 that they said might come into our country or has a little bit.
You don't mean Ebola, do you? No.
Yeah, I guess that's the latest one, right?
Well, let's hope it doesn't come into the country, but they're having a bit of an outbreak in Africa again. And we need to monitor people who are coming from those countries.
Yeah. Of course, a lot of that's at the national level, monitoring travel to and from those countries and trying to screen people on the way in. But, you know, right now, all medical providers, including the health department, you know, we're increasing our screening efforts in that area. So there's lots of things that happen that people may not know. Anyway, we could talk about that for a long time. Let's move on.
Are there any comments in the chat or questions, Sean?
No more.
Okay.
We do have several people watching, so anyone that's listening in, if you have a question, feel free to jump in.
Okay, next question. What would you say to the politicians and medical providers who are frustrated with your response?
Well, I've got to talk to a lot of politicians and medical providers who have been frustrated. And I tell them that we're doing the very best we can with what we have. And I explain the situation to them, and me and Stuart and Dr. Wayne, whoever talks to them, you know, we explain what's going on. Most of the time when they understand what we're up against, you know, they're okay with it. You all may, when we have 120 people on our board, we have 12 board members in each county, and that's 120 when you 12 times 10. So all of the county judges are on our boards, and there's several physicians on every single board and other medical providers. And we have routine meetings with our boards, and we have discussions about our response. And I mean, I think our boards have been largely pleased with how we've handled things. Now, that's not to say they haven't had suggestions or questions or critiques or whatever along the way, like you would, but I think our board has been largely satisfied. And our board's made up of local politicians and local medical providers. So again, a lot of this is a philosophical debate. You know, you might be aggravated that one group went ahead of another group in the vaccination process, or you might be aggravated that schools are back in session or that they're not, or you might be aggravated that businesses are being restricted or that they're not. You know, a lot of this is the things that we could debate, and you know, I understand there's good arguments to be made on both sides of those issues, but you know, all I can say is we've done the very best we could with the resources we had, and that, you know, this situation, information, particularly early on, information was changing. When I say on a daily basis, I'm not exaggerating. Sometimes it was changing on an hourly basis. So, you know, the research for a novel virus, you know, and the way to respond, and, you know, how do you respond when masking would be a good ideal, but you have a shortage of N95 masks and a shortage of surgical masks? How do you respond when testing would be a great ideal, but you don't have enough testing? How would you respond when vaccinations would be awesome, but you don't have vaccinations yet? I mean, all this has just been a quickly evolving situation where, sometimes we were changing our strategies daily, not because we don't know what we're doing, but because the situation was changing daily. We did know what we were doing. We were responding to the evolving situation very quickly. And I know people will get frustrated and think, well, why did you say one thing one week, one thing the next week? Well, something changed in that time period. And either the situation or the information necessitated that change.
Yeah. And I mean, it was, Sean, it was, we can add our own selves in as to, I mean, you and I sat in a room together for a year, and, we and Dr. Wayman, I mean, we were frustrated. We were frustrated because, it was changing fast and furious. Now, were we mad or anything like that? No. I mean, as
I got mad a few times, Stuart.
Well, yeah, but I did too. But as the science came through and we had to change things, I mean, that's part of it. Is it frustrating? Yes, it is. It's very frustrating. And literally, there were times I would tell somebody something, and just like you said, within 30 minutes or an hour, I would have to call them back and tell them something different. And yeah, I mean, that was frustrating, but I mean, this information, it came so fast and so furious at us and the changes were just, I mean, changing. Sometimes it changed every 15 minutes. So,
Yeah, it's been a challenge.
Yeah.
Go ahead, Dr. Wayman.
It's also frustrating that the funding for public health has been slashed over the last decade, and we have half as many staff as we did 10 years ago. Thus, it is frustrating to do a job when you don't have enough human resources.
And a couple of things. When Stuart said we sat in the same room together, we were more than 6 feet apart and had barriers. So we were following the guidance.
Yeah.
And one thing, Dr. Wayman, we were given allocations of money from the federal government that flowed through the state government to hire people to help supplement our response. And that was helpful. I mean, without those extra people, we wouldn't have had enough human resources to keep up. But those people that we were hiring, and they've done a good job, I'm not disparaging them in any way, but they didn't come in with years of public health experience and the right foundation of having gone to school and had the training in the right area. So we were able to use them, but in a limited capacity. The expertise that we lost over the last decade, the people that had the actual public health training and the actual public health experience, losing those people was really difficult.
And then not being able to build that back once we lost them. We weren't able to hire new people to start developing those people into the experts of today and the future. So 10 years ago, we could have had people with 10 years experience under their belts, 10 years of expertise, but we haven't been able to hire those people. So it's just a very few of us.
I think, I think it was the swine flu where we were doing the large pods. And when I say a pod, I'm talking a point of dispensing clinic. It's basically an off-site mass clinic. But then, the health department, we had the school contracts for school nursing for every school in our district. So we had a whole lot more public health trained nursing staff, and to be able to stand those things up and to do those. And, with the funding cuts and the changes in policy, we phased out the school program and the private sector phased in. So the schools are still getting school nurses, but it's not health departments supplied. And we lost those employees. And so, it's been tougher. While we had people that we could hire that could make phone calls, do case investigation and contact tracing, those people aren't qualified to go out and do the medical assessments and to do the vaccinations and to do the testing and things like that. So, but they have been essential for our response and have done a wonderful job. But it would have been nice having double the amount of, qualified public health professionals.
Okay, ready for the next question?
Yes.
If a person is exposed to a positive case but is 2 weeks past the second shot, what are the chances they will contract COVID? Should they be tested before they have contact with family? Could they get COVID and not show symptoms? And what is the safest thing to do in this case? Dr. Wayman.
Okay, so the vaccines we are using currently are somewhere between 75 and 95% effective. The effectiveness is dependent on the immune system of the individual receiving the vaccine. So if you mount a really good response, you will be protected, and if you don't, you may not be. So yes, there are failures. People can be infected after vaccination. And yes, they could have asymptomatic disease. After vaccination, probably they cannot spread it as well as asymptomatic disease before vaccination, because the viral numbers in the respiratory tract are not as high. So yes, you can become infected, and yes, you can spread it. So what's the best thing to do? If you are concerned with family members, then you should continue to use a mask, distance, and use good hand hygiene.
Yeah. So we said earlier, right now, our breakthrough cases is very, very small percent, less than 1%. But I don't want people to get the false sense of security and not, I mean, you get the vaccine as soon as you can, but until the vaccine the uptake has been really wide through all the communities, you still need to be cautious. We are seeing places in the world and places in our nation that are starting to surge again. Now we're early in that. Maybe that'll level off. Maybe that'll drop back off. We don't know. We'll watch the numbers week by week. Even in our own district for the past 5 days, our cases have started to go back up. So it's the concerning part is we've had about 30% of our population that qualifies for the vaccine has taken it. So we've still got a lot of people out there who qualify for the vaccine who hasn't taken it. And we still got a lot of people out there, either they've not had the vaccine or they've not been tested positive for the disease. So they're susceptible to catching it. So there's still a lot of room for this to spread and to surge back up. We certainly don't want to see that happen. We don't want to lose everything we've gained as a society since January. So, get the vaccine as quick as you can. And, over the next couple of months, hopefully everybody that wants a vaccine will have had the chance to have gotten it. And, everything should hopefully be better then and everything loosen up a lot by then. But, for the next few weeks, get your vaccine and be cautious.
Okay,
And remember, if you're around, you shouldn't be around unvaccinated people without a mask, whether they're your family or, not if they're not in your household. So especially if there is a little bit of leeway for fully vaccinated people in gathering, but not for certainly not for people who are not vaccinated.
And remember that, let me look this up in the brief here. We have, of the people who have tested positive for COVID-19, 1 in 56 has died. Now, our new case growth yesterday was 50. So approximately one of those people are going to die. So every day in our district, if we continue at 50, roughly one person is going to die. So keep that in mind. I mean, as there's reasons, there's a toll, a human consequence for not being conscientious on following the guidance. If you let your guard down and you spread the disease, somebody's going to die. I mean, maybe not. I'm not trying to lay the death on anyone. I'm just saying we're getting 50 new people a day, and one of those people are going to die. So, let's be cautious and prevent the spread as much as we can. We don't want any unnecessary death. So far in our district, we have 1 out of every 18 positive cases ends up hospitalized. That's a lot of people. So that's, roughly between 2.5 and 3 people every day are going to, if we continue at 50 a day, are going to end up hospitalized because of this. That's still a pretty, a pretty amazing impact for this disease. So there's plenty of reasons to be cautious and plenty of reasons to get your vaccine.
And we still are having people that there is no reason why these people should be gone other than, they contracted COVID and they were one of the ones that the illness made them very sick and then led to their death. But otherwise, I mean, there's no reason why that person should be, or those people should not be still alive.
Okay, next question. I have heard that a lot of people are preferring the Johnson & Johnson shot because of only having to take 1 shot. Can you talk to us a bit about how effective the Johnson & Johnson shot is versus the one that requires 2 shots of the vaccine?
Okay, so we really cannot compare these different vaccines in their percentages effectiveness because the trials were done at different times. So Moderna and Pfizer were done last year when we didn't have any variants. Johnson & Johnson and some of the others have been done later. I mean, the Johnson & Johnson just finished a month ago or so. By this time, we have variants, so we're looking at different situations. The vaccine is about 75% effective at preventing infection. All these vaccines are excellent at preventing severe or moderate illness, hospitalization, and death. So receiving the vaccine as soon as possible, whichever vaccine is available, is the best strategy.
Now, my suggestion is, what's the best vaccine for you? The one you can get.
Right.
Just go get it. Right. The Johnson & Johnson is supposed to start becoming more available over the next few weeks. There was a big push of Johnson & Johnson vaccine when the FDA first approved them. They got a big bunch out, but now they've had to go back into production mode, and they had everything that they had stored back pushed out. So, but it's going to start becoming more available, but don't wait, get it as soon as you can. The best vaccine for you is the one that's available to you. So get it.
So Sean, why don't you share a little bit about the vaccine clinics at the health department and what's happening with us currently?
We're taking appointments right now. The CDC and the State Department for Public Health have expanded the eligibility criteria to anyone in 1C, which is 50 and older, and anyone that meets that long list of proven health criteria, health conditions that could make you more at risk, plus the long list of things that might make you more at risk. So basically, most people qualify for the vaccine right now. So, call and get you an appointment. We have over 6,000 doses of the vaccine coming into our district each week. There's lots of providers. Just go to our website and you'll see a list of every provider that we know about that's getting the vaccine. The health department, we're taking appointments right now. We still have, I think, just a very, very few slots in a few counties for our allocation for this week. And, we've got our mobile unit now, so we're starting to do some special clinics. I don't know if you all have followed the governor's report, but the health departments have been given a specific special task outside of what most of the other providers are given. We've been given the task of trying to reach out to the more difficult to reach population, homebound, and maybe people that don't speak English, that haven't been able to keep up with things as well. So, we're doing maybe people that work at certain businesses that were reluctant to take it early on, trying to go back and get those. So, we're going to use some of our supply for the special populations and some of our supply for our clinics. But there's plenty of vaccine around right now. More vaccine than there's more supply now than there is demand. So you should be able to find it.
And like Sean said, we're to the point of kind of hitting a wall because, of course, there is more supply than demand. But it shouldn't necessarily be that way. If we've vaccinated 30%, I mean, there's still 70% to go. And what we're finding is there's a huge amount of, beyond the people who's already got their vaccine, beyond those healthcare workers, beyond some of the teachers, beyond the 60-plus-year-old people. When you get down below the 60-plus-year-old people, we're finding there's a huge amount of hesitancy in taking the vaccine. So Dr. Wayman, would you just reiterate that how safe the vaccine is? And you're looking at 4 people right here who've taken the vaccine, and some of us are 50 and a little less, and we're fine. We're fine.
And sometimes, Dr. Wayman, while you're answering that, people express concern about reproductive health with the vaccine, so you can talk about that too.
But I was just thinking to say that before you all put me on the spot anyway. But basically, we had trials with thousands of people and the safety was shown in there. But more to the point, we've now given millions of doses of these vaccines. And there is an ongoing system for finding out side effects or adverse effects. And we are really seeing very few severe side effects. Rare cases of anaphylaxis or severe allergy, and otherwise the side effects are usually due to your immune system revving up to produce antibodies, etc., from the vaccine. There is absolutely no evidence that it has any effect on fertility, and there's absolutely no evidence at this point that pregnant ladies have any problems with the vaccine or that their fetuses have any problems. The trials did not include pregnant ladies, but about 30,000 have already received it, and there are no reports of adverse effects.
Yeah, and every vaccine that's given, like, we're all familiar with the vaccines that kids have to get as they go through school. They all have a chance of not working. They're all, none of them's 100% effective. They all have a failure rate, and there's always a chance of side effects with all the vaccines. Very small chance. This vaccine is proving to be no more risky than any vaccine that you get, and no less effective than the other vaccines you get. So, the companies that made the vaccine, this is what they do. They know what they're doing. It goes through a vigorous process through the FDA and other equivalent organizations in other countries to get approved. So, we got a whole lot more chance of people dying or being hospitalized from getting COVID-19 than we have chances of people getting sick from the vaccine.
Yeah, don't be the person who's laying in the hospital on a vent saying, "Man, I really wish I'd have taken that vaccine."
Well, we know how many people did we say are in the hospital right now?
26, I think.
25 people right now are in the hospital. wishing they had, I don't know, maybe one or two of them did have the vaccine. Most of them probably didn't, and wishing they had.
Yeah. And I will say, we've developed, and Dr. Wayman can chime in on this, we have been developing vaccine for years upon years upon years. You look back at smallpox, you look back at vaccines that people took back in the 1960s. Our medical system today is much more advanced and much more robust. In studying these vaccines, our vaccines have improved. I would venture to say that we know much more about our vaccines today than they did when they were developing vaccines 40 and 50 years ago.
And some people are concerned that this vaccine came to production so quickly, but there was nothing in the whole process that affected the safety. The reason it was so quick is because the governments supported pharmaceutical companies to actually produce the vaccine after they found that it was effective in small studies, while at the same time they were doing trials. Normally this would not happen if they didn't get funded, because why would you produce vaccine if you found later that it was not effective? But so we are very lucky that they were found to be effective at the same time as they produced the vaccine. So it was ready to roll as soon as the results were available.
Well, so far, there's been, I don't know how many millions of people 30% of the United States represent, but it's a lot. And there's been very, 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 very few significant side effects to the vaccine. So, like I said, we know 1 out of every 56 people is going to die when they contract COVID-19. We know that 1 out of 18 is going to end up in the hospital. Your chances of negative health outcomes are many hundreds of times more likely if you contract COVID-19 than having any kind of side effect from the vaccine. So please get the vaccine. Please get it before we get another surge. I can't tell you how much we don't want another surge. I know no one wants it, but man, the healthcare workers and the health department workers, we're wore out with this. We certainly don't want another surge. So please get the vaccine, and please be cautious for the next couple of months. Tracy, I think that was the end of the questions.
Yes.
We'll give some kind of closing comments in case anyone wants to. We got a good number of people listening in live. If you want to put in a final question or comment in the chat, we'll address that. The live chat's about on a 20 or 30-second delay. So, we'll just kind of stall here for a second and see if anybody's got any last minute questions.
We would like to return to normal. We would like the economy to return to normal. Vaccination is the way to go.
Thank you, Dr. Wayman. What about you, Stuart?
Just again to say that if you want to get back to normal, then you need to go get vaccinated. I suppose that if you're one of the persons who don't want to, then that really means that you want to wear a mask and you want to continue with restrictions, and you don't want to be back to normal. We have to be part of the solution. Everybody has to be part of the solution. That is the only way.
We have a certain number of our population, Stuart, that they're not going to wear a mask. They're not going to get the vaccine. It doesn't matter what anybody says to them. But we do need enough people to get it that we achieve, the herd immunity, or we get really close to it, and we're not there yet. So we definitely need more people to get it. I don't want to have to announce a death a day, or 3 or 4 new hospitalizations each day. So let's finish this out over the next couple of months. Let's finish out strong as a community. Let's get the vaccine and be cautious for a couple more months.
Any
I
more
don't see any more
questions?
questions, Tracy, so I think
Okay.
we're done if you want to close us out.
All right. Thank you all for joining us today. We will be back on April the 7th, which is in 2 weeks on a Wednesday at 2:00. If you have questions, please send them our way and we'd be glad to answer them. Thank
Yeah,
you all. Have a good day.
Thank you all for tuning in.